haven't seen.
Started, if we can maybe open our Office of the Aging agenda for Monday, June 22nd. Is Dee available?
Yes.
Great. Why don't we forge forward?
Good morning.
Good morning.
All right. The first item on our agenda is permission to submit our 2020-2021 New York Connects grant application in the amount of $203,636. This grant is 100% funded, and it allows us to run our New York Connects program for both Warren and Hamilton counties.
Great. Can I get a motion to that effect?
I'll make that motion.
By Edna, seconded by Supervisor Beatty. All those in favor?
Aye.
Aye. Let me just back up for one moment if I can. Can I get a motion to approve the minutes of our prior committee meeting? Supervisor Beatty, seconded by Supervisor Conover. All those in favor?
Aye.
Number 2, Dee.
This is permission to fill our meal site manager number 5 position at the Warrensburg meal site, grade 2, base salary $27,438. This is a 25-hour-a-week position, which is $13.19 an hour, due to resignation on 6/16/2020.
Very good. Can I get a motion to that effect? I see a motion by Supervisor Conover, seconded by Supervisor Frazier. All those in favor?
Aye.
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 Thank you. It passed. Number 3.
This is permission to fill our fiscal manager position due to retirement. She is currently slated to retire on July 10th, 2020. I am in discussions with Civil Service, the county administrator, and Tammy DiLorenzo to figure out what the appropriate grade and base salary will be. So we're still working on that, but we will not have it higher than a grade 12 in our non-bargaining position salary schedule, with a base salary of $55,051. But again, we are discussing this, so it may be lower than that, and we are hoping to have this done by the Personnel Committee meeting.
Wonderful. Can I get a motion to approve that? I see a motion by Edna, seconded by Supervisor Conover. All those in favor?
Aye.
Very good. Dee, just a quick question maybe on my part. With the pandemic and the health issues and the impact on senior citizens, it's got to be a little frustrating for you in terms of carrying out your job, in terms of the pressure that senior citizens feel within our county or throughout the state. So we continue to encourage you to provide the kind of perspective and attitude towards our senior citizens, and we thank you for that.
Thank you. I've got a great bunch of staff here in the office and at the meal sites that are continuing to do their utmost to provide the services that our seniors need.
Great. Thank you very much. Does anyone else have anything that they'd like to add to the meeting? Privilege of the floor, see none. Can I get that's all. So we will get a motion to adjourn, and we'll move on to our next.
No, you don't need a motion to adjourn.
Great, thank you. We will move on to health services. Is Janelle Jones in the room? We think she's in the room.
Can you hear me? Can you hear me?
Yes, we can. Thank you very much. So Janelle, number 1, we'll move on here.
All right. Good morning, everyone. So most of our resolution requests are for positions. The first one is to approve filling a full-time public health nurse, number 35. The position is a grade 21 with a salary of $50,816. attachment 7. This position's needed and our health services is in continuous recruitment. This position is revenue generating based on insurance reimbursement. The position technically was already approved, however, our intent to fill form needs to be updated.
Great. Thank you, Janelle. Can I get a motion to approve Supervisor Shepler, seconded by Supervisor Conover? All those in favor?
Aye.
The next resolution.
Okay, the next one is to approve filling a part-time up to 20 hours per week infant feeding advocate. This is in our WIC program. This position is a grade 3 and the salary is $28,026, which is prorated to $13.47 an hour. That is attachment number 8. This infant feeding advocate position is required by our WIC program and is 100% reimbursable with WIC funding. The position, again, was already approved. However, the intent to fill needs to be extended. And just to clarify, the majority of the reason these intent to fills have expired or lapsed was because through COVID, we really didn't want to hire a new person and have them work from home without any guidance and orientation.
Thank you. Can I get a motion to that effect? I see Edna made the motion, seconded by Supervisor Beatty. All those in favor?
Aye.
Thank you. Next request.
All right, this next request is to approve filling a part-time medical records coder. This position is a grade 10. The salary is $37,633, prorated to $18.09 per hour. This is attachment number 9. This position was created with our budget for this year. It's going to optimize revenue for our certified home health agency. This position was, again, already approved. We just need to extend the intent to fill position. And just to clarify, I do have an outsourcing capacity. With our medical records system, we're having a hard time getting a work plan for that. Initially, we were going to depend on the outsourcing and not hire, but we needed the flexibility. But at this point, with the business picking back up, we need to go ahead and act on this. So that's why we're putting the position in.
Thank you, Janelle. Can I get a motion to that effect? Supervisor Beatty, seconded by Supervisor Shepler. All those in favor?
Aye.
Aye.
Next item.
This next position is to fill the full-time public health program manager. The position is a grade 21 and the salary is $50,816. The position became vacant June 12th due to a resignation. This is attachment number 10. This position has become a vital position to our department and assists with all of our programs and fills gaps throughout our whole agency. The position assists home care with our electronic medical record, which is huge. The position is reimbursable through state aid and general public health works grant, and that's about 36%.
Thank you. Can we get a motion to that effect? Supervisor Beatty, seconded by Supervisor Conover. All those in favor?
Aye.
Next item.
The next is a request for transfer of funds in the 2020 budget, attachment number 6, and I will turn the floor over to Ton Driscoll, and she can also cover the first 2 reports as well.
Okay, attachment number 6 is our request for transfer. I'm just asking for one. It is for a home care nurse that has been utilized over on the public health side since March, I believe. Helping with all of the COVID ideas. She's been unable to work with the child. I have to move the money from our home care over to the public health to cover this. I've done this once. We've utilized all those funds, so I'm moving another $10,000 over there to cover as far as we see, and then we'll see again in a couple months. It tends to take about two and a half months to get through this. So I just need to move over some salary and some fringe over from the home care side to the public health side to cover this position.
Can we get a motion to approve attachment number 6, Supervisor Conover, seconded by Edna Frazier. All those in favor?
Aye.
Thank you.
Now on to attachment 1, which is our financials. This was as of June 15th for all of expenses except for the payroll. The payroll that was done the beginning of June hadn't been posted yet, so I had to do a little tweaking a little bit here, but all the expenses are as of June 15th except for payroll. So I did have to go back and compare payroll to the end of May this year to the end of May last year. You will see our expenses and our revenues. We did also accrue in our revenues $29,842 for our WIC April voucher that we just did. I wanted to note that year to date, our COVID, and when I say COVID, strictly COVID funds that we were given by we will be given by the state. Of that so far, 21,466 was all of it, but most of that is fringe and salary, again, for people who've had to put in overtime and the fringe related to that to get through all of this for the last couple, 2-3 months. Our salaries below do reflect those COVID numbers, even with that, because it is covered, but even with that, you'll see that we are down over $50,000 from last year at this time. Our part-time and overtime have gone down, obviously, because we are not doing clinics. We haven't used our per diems when it was, we really did what we needed to do to get through all this. We're 32.76% of the budget right now, and last year at this time we were at 39.71. So we're staying pretty much the same as we've been for these last 3-4 months, and getting through what we need to do, even with the COVID affecting us. Attachment number 2 is our comparison again from last year to this year, just to give you an idea. Salaries, as we just talked about. Equipment, there were any changes. We do have 2 vehicles that we have now purchased, and we're waiting for our third one. Will be here by the end of this month. Under contractual expenses, it is down, but again, it's due to the timing of invoices with our preschool and early intervention. There was a little bit of a hold on tele services, and so once they were allowed to do that, I think that was around April 1st, is when they started to allow that. So we kind of went a few weeks in March, and then once April started, some protocols had to be put in place because they weren't actually seeing the children. But we got that all in place, and now we've been getting the bills. So again, it's just been some timing for that. Employee benefits are down a little bit, again, related to the salaries. And then our revenues reflect, as I said last month, the stimulus payment. I left that in there just because I always want to bring that. Our patient census has increased due to the opening of elective surgeries and physician visits, and therefore our child starting to see an increase in referrals starting in May when that all opened up. We're starting to see that, and it's getting back to more of a normal routine. Our clinics also, I just want to remind you, we still have all our public health clinics are closed, so therefore those nurses are not being utilized either.
All right, on to the third attachment. This is our status of referrals. You'll see that we're down. This was probably the first month that, because of the elective surgeries not taking place, people not going to providers and doctors, all the home care agencies were seeing a dip. As Ton said, we have noticed just by a feel that it appears that business is picking up now that things are starting to reopen. We're now seeing surgeries happen, so we're getting those referrals. So it'll be interesting to see what next month in June brings us for our numbers. So I wouldn't be too concerned about April, but that is quite alarming, I give you that. But we are happy to see things picking up. Also, in regard to our revisits, at the very bottom, we're down 162, which averages out to about 40 per week. Again, if we're not seeing people with their elective surgeries and things like that, we're not able to do the visit. So we're just happy to see things are picking up. Also attached are our emergency response and preparedness activities and our rabies report. We are starting to see bites, and we're starting to send off rabies specimens, so that program's picking up a little bit, but we are still able to kind of accommodate all those needs. I don't have any meeting authorizations at this time. Jumping to a COVID update, I was planning to provide a COVID update, and I certainly am here available for questions, but luckily with our numbers, we're trending down. We currently only have the 1 active case with the 4 quarantines that we're managing. So I guess at risk of being redundant, I won't repeat all the information that Ryan gives you in your daily updates unless there's questions. But just because things are slowing down a little bit, I did want to acknowledge the help from the Sheriff's Department. I know I say this every time, but I mean it as genuinely every time. The Sheriff's Department was absolutely amazing to work with, as was other departments that we worked with. But when our cases went down, and it was kind of at the time of the protest as well, public health took back, and actually probation helped too. I should throw that in for the weekend of the protest. But we basically have taken the visits and the calls back from the Sheriff's Department just because we can certainly assume that within our own department at this time. The Sheriff's has graciously agreed that, you know, if numbers pick up and we need help, that they still are there for us. But the partnership has been amazing, and the collaboration has been great, and we're very appreciative, and I just did not want that to go unnoticed. We are starting, as things reopen, we get a lot of technical assistance calls looking for clarification or what does this mean kind of calls. We do refer them to the New York Forward website, but when they're talking about testing and maybe have questions understanding what they're reading, we've been doing a lot of guidance with that regard. Happy that we now have a little bit more time freed up to be able to do that. And as far as the two biggest things worth noting, our testing clinic, we decreased the hours right now just to try to, you know, use our resources wisely and not waste resources from the hospital or public health. With our capacity right now, we're easily able to do that within the 2 hours. If we need to ramp it up, we can do that in a heartbeat. So I feel very good about that. But for right now, you know, we're cutting it back to the 2 hours. We're also cutting our staffing back on weekends. We've been operating 7 days a week. We still technically will, but I'm cutting back the clerical and the nurse on the weekends. Pat and I will still be monitoring diseases and able to, again, ramp up very quickly should we have a surge or have cases or anything over the weekend. But our calls have cut way down, so we'll be answering those with an answering service. And again, if it ramps back up, we'll be happy to bring the clerical people back on to help us with the phones on the weekend, but we think that that's totally manageable right now. So that's all I have right now, unless people have questions with regard to COVID.
I really just have an observation, Janelle, that it really has to do with, I guess, the general smartness. The public always seems to be one step ahead of, you know, the average politician. And from the perspective of their recognition of the necessity for wearing a mask, of their acknowledgement that social distancing is reasonably important. So I just think that message, I think, has gotten out into, at least in my limited experience, has gotten out there, you know, with the public at large. And so I think your efforts in terms of maybe getting that message across, I think, has been helpful and I think effective in terms of, again, my limited experience with as to where I go on a given day. So I thank you for that, Janelle. Any further comments from anyone? Supervisor Conover.
Thank you, Mr. Chairman. Really just, Janelle, just really a comment. These financial numbers are very impressive. I mean, we all know what a great job the team has been doing on the COVID program and the resulting numbers. But these numbers, these financial numbers really speak to doing a great job in maximizing the resources that you have. So really, and this would include Ryan and the whole team, really, kudos to everyone. We could be looking at a totally different financial situation here than what we're looking at was being presented to us today. And so my congratulations to you and your whole team, and please pass it along.
Absolutely. Thank you.
Thank you, Supervisor Conover. Any comments from anyone else on the committee? I see none. Can I get a motion to adjourn? Supervisor Beatty, seconded by Supervisor Conover. The meeting is adjourned. Thank you. Have a good day.